My name is Dr. Emily Malgor. I am a vascular surgeon in the CU Medicine Clinic at Highlands Ranch Hospital. I think I initially wanted to become a doctor because I always was interested in doing some form of service where I would be caring either for people or animals. So going way back, I liked veterinary work, and then it progressed into wanting to be doing more work with people. And my mom was a nurse, and eventually that became clear to me. And I think the vascular surgery component of it solidified when I was in medical school. And my rotation on vascular surgery involved two very influential surgeons in New York that I worked under. There are a lot of reasons to see a vascular surgeon, and sometimes it doesn't mean that you need surgery. I think the patients I probably see the most who didn't realize they needed to be seen by a vascular surgeon are those with non-healing sores on their legs or feet that have just sort of hung around for a while. They could also be suffering from cramping or pain with walking that they didn't realize might be related to low blood flow or poor circulation. Patients who have any kind of dilated arteries that we refer to as aneurysms, those are things that I fix. And I do a lot of work with aneurysmal disease in the neck, in the chest, the abdomen, and the limbs. But we treat these dilated arteries in the belly as well if they involve any major branches to any of your inner organs. I do work with improving blood flow to the brain, to the arms and legs, and to other areas of the body. It always starts with a physical exam, and more often than not, I will be obtaining imaging studies because a lot of vascular surgery depends upon how the vessels function and how the vessels look. And without an imaging study, a lot of it is guesswork. So the physical exam helps us get a better sense of a patient's symptoms and history. And that plays a large role, not only in figuring out what they may need, but also in deciding how aggressive we are with treatment, because the patient's expected outcome and goals are a huge part of vascular surgery. My favorite part of being a vascular surgeon is twofold. I would say one is working up what can sometimes be a very complicated disease, and we sort of downplay our role as being plumbers because we're often rerouting the blood flow in the body and altering its function, altering its course. But my other favorite thing about being a vascular surgeon is meeting people. A lot of my patients are very interesting in terms of what they do, what brings them to my office, their family dynamics. And I would say if I had more time in the office to talk to them on a personal level, I would take it.